Hello, so this is Cardiac Surgery Patient Pre-Op Booklet, Part 3, Recovery and Returning Home. What to expect after cardiac surgery. Incision swelling. A slight puffiness or swelling at the upper end of your chest incision is normal following surgery. If you have had bypass surgery, you may also experience a slight puffiness at the lower end of your of your leg incision. Swelling of the leg after removal of a vein is common. Elevating your leg or foot above the level of your heart will help decrease this swelling. You may notice swelling in areas of numbness around your incision. This is normal and usually resolves within 6 months. Excuse me. Pain. It's normal to have some incision and muscle discomfort. Take your pain medication so you can deep breathe, cough, and do your physical activities. If your medication is not giving you relief from your discomfort, tell your nurse. It is important that you are able to cough, deep breathe, and move. Numbness. Numbness may occur in your toes, fingers, wrists, or legs due to pressure on or stretching of nerves. It often disappears in several weeks, but sometimes the nerves are divided. And this numbness is permanent in small areas, especially in the legs. There is frequently a temporary pins and needles sensation or numbness of the chest wall when an artery in the chest is used. Dry mouth and sore throat. Dry mouth and sore throat are common side effects of the anesthesia and breathing tube. They usually clear quickly. Excessive perspiration. This condition frequently occurs after cardiac surgery, usually at night. It often continues after discharge from the hospital. It will go away in time. Emotional up and downs. Variations in moods are common following any operations. These ups and downs may happen once you are at home again, but they will gradually go away. People who understand this is normal usually have the fewest mood changes. You may feel depressed or weepy. You may not sleep well at night and occasionally have nightmares. Often it helps to talk openly with your family nurse or doctor about these feelings. Please let your doctor know if you are having difficulty and feel you need assistance. Difficulty with concentration. You may have trouble reading or focusing. Let your nurse know if you notice this happening. Your ability to concentrate usually returns to normal after several weeks after surgery. Sleeping habits. You may notice that you are having some trouble sleeping at night. This is normal and will usually go away soon after surgery. It will help to avoid caffeine and or take fewer naps within the day, and to tire yourself out somewhat with increased walking. Some people find a recliner more comfortable to sleep in the first few weeks after surgery. Tiring quickly. As you become more active, you may find that you tire quickly. Increase your activity slowly, going just past the point where you begin to tire. Stop and rest before going back to your activity. Appetite. You may not feel like eating much for the first few weeks, but you must eat to increase your strength. It is important to drink fluids if you are nauseated and cannot eat. Your sense of taste and smell may change temporarily. Try to relax and know these senses will return to normal. If you are having difficulty finding foods that you can eat, it is sometimes possible for your family to bring in special items. Please ask your nurse if you have any questions. Bowel changes. You may have had some constipation at first, which is often due to pain medication and decreased activity. Please let your nurse know if this is occurring so a laxative can be given. Fruit and fruit juices, as well as bran cereals in your diet, will help with this condition. Irregular heartbeat. Many patients develop an irregular heartbeat rhythm following surgery. It can feel like an unpleasant fluttering sensation or palpitations to some people. This is most often treated with medication. It is almost always a temporary condition. Activity. At first, your nurse will help you get up and walk in your room. As you progress, you will be encouraged to walk in the hallway to improve your circulation and increase your strength. Becoming active early after your surgery is important for after your recovery. Remember, you are not sick but recovering from surgery, and your heart is probably in better shape than it was before. It is important to use the incentive spirometer every 1 or 2 hours when you are awake to help keep your lungs clear and strengthen your breathing muscles. Recovery and going home. Most patients leave the hospital when they can walk independently, eat, and have a stable condition as determined by the surgeon. Prior to your discharge, you will be given instructions to aid in the recovery at home. The cardiac nurse will provide you with exercise instructions and a walking program that will help you recover. Instructions regarding activity, medication, and follow-up appointments are generally given before or on the day of your discharge from the hospital. Questions commonly asked by patients and family are answered on the following pages. This information is not meant to take the place of the surgeon's instructions, but may supplement them and help you better understand your recovery at home. If other questions arise, please feel free to call your surgeon's office or your care coordinator. Going home. If your car ride home after discharge takes longer than an hour, use to stop every hour and take a short walk and help the circulation in your legs. You should wear a shoulder-type seatbelt while riding in the car. Don't be surprised if, with all the excitement and activity of your first day out of the hospital, you need to take a nap once you get home. Your care coordinator. The care coordinator is specially trained RN who is responsible for your care from pre-op to about 4 weeks post-op. They are available for questions prior to your surgery and will follow you throughout your hospitalization. They will monitor your progress after discharge and remain in contact with you until your first visit with the surgeon. Doctors. When you are discharged, you will be scheduled to be seen in the surgeon's office in 3 to 6 weeks. Feel free to contact your family doctor with any questions not related to your surgery. Your family doctor will receive a written record of your hospitalization, and every effort will be made to keep your personal physician informed. Contact your surgeon's office if you have any questions or concerns regarding recovery. NPS and PAS. Nurse practitioners and physician's assistants are important members of the cardiac team and are sometimes available when your surgeon is not. They are always in close contact with your doctor. Feel free to ask them any questions regarding your surgery. Care for your incision. Everyone has some discomfort and aching in and around the incision. When you're at home, it is important to check your leg and chest incisions if there is drainage that is cloudy, thick, or yellow in color, or the incision is red, hard, inflamed, and painful. An infection is a possibility. Contact your care coordinator or your surgeon. All incisions should be washed twice a day with soap and water. We suggest you use antibacterial soap. Dressings are not needed unless there is draining. Applying ointment or creams is not recommended. These may break down the surgical glue impair healing. To operate on your heart, the surgeon made an incision through your sternum. Separating the sternum during surgery placed pressure on your rib cage and back. Therefore, you may have some discomfort in your neck, shoulders, and back. This discomfort is related to muscle spasms and may last 6 to 12 weeks. Take your pain medication as directed. Massage and the use of a heating pad may also help. Some people have very little or no pain or discomfort. It will take you about 6 weeks for your breastbone to heal. Stainless steel wire is used to stabilize your breastbone as it mends. You may have a pin-prick sensation at the site of your incision, but this is normal and will go away. Support stockings. In the hospital, you receive white support stockings that should be worn until you see your surgeon in the office for your follow-up visit. Someone should help you put the stockings on because too much pressure may be put on your chest incision if you attempt to do it alone. You can take off your stockings at bedtime. Be sure to wash the stockings every day. It is not unusual for your foot to swell. Elevate your leg on a stool while you are sitting. Do not stay sitting for more than an hour at a time. If your foot becomes swollen, elevate your leg higher than your heart. Place at least 2 pillows under your foot when going to bed. If your foot becomes so swollen that you find it hard to put weight on it, you should call your doctor. At home, you will need to use the incentive spirometer at least 10 times, 4 times per day. Use of the incentive spirometer will keep your lungs clear, strengthen your breathing muscles, and help prevent complications such as pneumonia. Medication. Medication is an important part of your recovery after surgery. Some medications may need to be taken for only a short while, while others may be used long term. Some of your previous medications may be changed or discontinued. You should learn about medicines that are prescribed for you, specifically their names, the purpose, when and how they should be taken, a medication schedule, and information on your medicines will be given to you before leaving the hospital. Your physician or nurse will discuss your medicines with you before you are discharged, and again at your follow-up visit. Your medications may be different from what you were taking before surgery. Only take the medications prescribed at discharge. Pain medication. Before you leave the hospital, you'll be given a prescription to help relieve the discomfort that you are feeling around your incision. Not everyone needs pain medication, but using it as needed will allow you to follow your exercise program. Rest well at night and speed up your recovery. Some pain medications cannot be refilled over the telephone. If you have any questions about your pain medication, you can contact your primary care provider. You may use a heating pad or hot water bottle to help ease soreness. Do not place directly on incision. So tips on taking medication. Have a regular time to take your medicine. Don't skip doses. Don't take more or less than prescribed. Plan to get a refill before you run out. Don't stop your medicine on your own. Keep medicines in their own bottles to help avoid confusion. Keep your medicines out of reach of children. Keep medicine in a cool, dry place, not in the bathroom medicine chest where there is moisture. Check with your doctor before taking over-the-counter medications. Avoiding constipation. Most pain medicines cause constipation. Follow these tips and the problem may be avoided. Drink 6 to 8 glasses of fluids a day. Avoid milk. Eat more high-fiber foods such as bran products, fruits, and vegetables. Over-the-counter medications such as milk of magnesia, X-Lax, and Metamucil can be used. Follow your exercise program. Diet. Unless you are a diabetic or have some type of medical problem, you may eat whatever you want the first month, except salt. It is very common to feel hungry after heart surgery, so we do not restrict your diet for 1 month following surgery. After a month is over, if you have had a coronary artery bypass, you should follow the low saturated, low sodium diet. After surgery, fluid occasionally builds up in the body, so you should avoid salty foods and track your weight. Salt acts like a sponge and keeps extra fluids in your body, which makes your heart and other organs work harder. You may cook with a little salt, but don't add it to the table. Add it at the table. You may want to try a salt substitute. Weight. It is important to know if you are retaining fluids. Daily weights help with this determination. You should weigh yourself every morning at the same time and track it using the weight tracking sheet that will be given to you at discharge. Call your doctor or care coordinator if you notice a weight gain of more than 2 to 3 pounds overnight, or 5 pounds in 1 week. You may not feel short of breath or having any swelling in your feet. So you may feel short of breath or have any swelling in your feet. After you weigh yourself every morning, record the weight and bring the chart with you when you visit your doctor.